So on to the next. We're trying to talk about pathophysiology of congenital heart diseases. Pathophysiology of congenital heart diseases. So pathophysiology, I'm just trying to talk about, step by step to why this disease condition actually came to be. So for congenital heart disease, how did it actually come to be? So what we are having here is, it actually revolves around what structural abnormalities in the heart. That's like if you're having congenital heart defects, you can pause to observe different types. You just have to do it. There's a hole in the heart, the hole is not supposed to be there. Maybe a blood vessel is growing where it's not supposed to grow. There are all those drama. Okay, you have it in congenital heart defects. So there's issues in heart or great vessels, so it's disrupting the normal blood flow, disrupting how the person is receiving oxygen, disrupting pressure dynamics. You understand? So the core mechanisms, like how this congenital heart defect actually comes to be. So shunting lesions, so left to right shunt, so blood flows from what? High pressure left side to the right side. You have it in congenital heart defects like this. So ventricular septal defect, atrial septal defect, patent ductus arteriosus. So this leads to pulmonary overcirculation. The blood entering, left is what? Oxygenated blood, right is what? Deoxygenated. So blood is moving from the left to the right, then into the lungs. So the blood entering the lung is too much. This could lead to volume overload. It still has an effect on the heart, causing heart failure. So right to left shunt, this one, deoxygenated blood is moving into oxygenated blood. Oxygenated blood moves to the system. So your tissues, your blood vessels, tissues in general are receiving what? Blood that is mixed with oxygenated and deoxygenated. Then obstructive lesions. You could have narrowing of valves and vessels like aortic stenosis, coarctation of aorta, pulmonary stenosis. This will result in pressure overload, ventricular hypertrophy, reduced cardiac output. Okay. So mixing lesions. So sometimes, oxygenated and deoxygenated blood can mix abnormally. It's mixing vice versa. Okay. Regurgitant lesions. This one just have to do with valves are there to make blood flow one way. Do you understand? So if you're having issues that blood is flowing into a particular segment of the heart and is flowing backward again, that's regurgitation. Of course, regurgitation causes volume overload, chamber dilation. This will also lead to what? Heart failure. Alright, that will also lead to heart failure. So moving forward, so systemic effect, pulmonary hypertension. So sometimes the blood moving to the lungs is too much, so you have effect on the lungs. So you're having many organs failing now. So if the volume is overloaded too, it can now have an effect on the heart. If the lungs are full, the heart can no longer pump blood to the lungs. So you're having like a backlog in the heart too, leading to heart failure. Then of course oxygen supply is not adequate again, so you're having all those cyanosis, then growth and developmental delays. Okay, so that's it for the pathophysiology, the various mechanisms to how these congenital heart diseases actually come to be.